Dear colleagues from Bulgaria, thank you for the invitation for participating in your fifth conference. I wish you a pleasant conference and good work discussing the pharmacy technicians' roles in Bulgaria. My name is Kристиано Matos. I'm president of the European Association of Pharmacy Technicians, also president of Portuguese Association of Pharmacy Technicians, and I was pharmacy technician in a community pharmacy for 10 years. And right now I'm teaching pharmacy technicians in Portugal. I teach pharmacotherapy, pharmacoepidemiology, and pharmacovigilance. So I would like to present you the European Association of Pharmacy Technicians. European Association of Pharmacy Technicians, it's a not-for-profit organization that aims to enhance and strengthen the education, the role, and the recognition of pharmacy technicians in Europe. And what we do is trying to support the pharmacy technicians profession and role in different countries and try to ensure the safety and security of patients at European level. We conduct a lot of research about pharmacy technicians at European level, and with that knowledge, we try to support countries to discuss the roles of pharmacy technicians inside their countries. At the moment, the European Association of Pharmacy Technicians have 12 members. Those in red are the members. And as well, we have several contacts with different organizations that are not members, but with that organizations, we also share some information. And Bulgaria, it's one of those organizations. We get the first contact in April this year in Stara Zagora. I will share some ideas about that meeting later. We also have some countries, the ones that are in blue, that are academic members. It means that they are universities representing pharmacy technicians education in that countries. So at the moment, we represent around 20 countries at European level. So as I said to you, last April, I was in Stara Zagora for a professional meeting in the university, and I met with Mrs. Liliana Petrova, your president, and other members of Bulgarian Association of Pharmaceutical Assistants. And we discussed the first contacts with the Bulgarian Association and the opportunity to work together and to collaborate. The meeting was hosted in the Trachea University in Stara Zagora, and we had the opportunity to discuss how European Association could support your activities in your country. So in Europe, there are different levels of development of pharmacy technicians. We are evolving profession at European level, but we are very heterogeneous. In some countries, pharmacy technicians perform tasks more in community pharmacies. In other countries, they develop more activities in hospital pharmacies, and in some countries, they do both. We are very important in the healthcare system because no pharmacy chain could work without pharmacy technicians, for sure. And we need to acknowledge that we have a very important role in multidisciplinary teams, supporting pharmacists, supporting nurses, supporting doctors with the drugs. So we are very important in that multidisciplinary teams. Of course, the pharmacy technicians in Europe wants to cooperate between countries, and that's the reason we created the European Association of Pharmacy Technicians almost 10 years ago. And with that cooperation, we support different countries in government decisions. For example, when a country wants to develop their roles, their tasks, when they want to have more rules, they could use the example of the other countries as argument to have that decision made in their countries. In the last years, we supported different countries in decision. For example, right now we are supporting Luxembourg. They are trying to be regulated, so we are trying to support them in that decision. We are supporting Ireland in trying to be regulated as well. And also we support some countries that want to develop their education. For example, when they have higher level, not higher level education, secondary level, and they want to grow to university level, they could also share the information about other countries to support that movement. The recognition of pharmacy technicians in Europe is quite low. In some countries, pharmacy technicians are not well recognized. And that's why in European Association of Pharmacy Technicians, we started to celebrate the International Pharmacy Technician Day in 2023 for the first time. And this year we will celebrate also the International Pharmacy Technician Day, which will be in October 15. And we will share with countries information to support the recognition of pharmacy technicians in your countries. We will support countries with images, with message to try to have more recognition for pharmacy technicians. So in Europe, pharmacy technicians are a regulated profession in 22 countries, and Bulgaria, it's one of them. You are in the last line of this slide with the name of your profession. And if you look at the information that you have a very good qualification level at the moment. According to the directive of professional movement, you are in a very high level of development of your education, which means if someone from Bulgaria wants to move for another country, you have no problems in the recognition of your professional title of pharmacy technician in other country. So you are between the countries that have the profession regulated. Bulgaria, it's already in the best level of the development of the qualification level. So I believe this is not your problem at the moment, but from the discussion that I have in the week that I stay in Bulgaria, I understand that pharmacy technicians have different issues and different problems in community pharmacies. For example, they are not allowed to dispense prescribed medicines, but this is something that you should fight to have, because you have a very decent level of development education. So this is, I believe, a very good step to go forward. This is not a situation that you only have in Bulgaria. In other countries, some pharmacy technicians are not allowed to dispense prescribed medicines. And this table explains a bit the differences between the roles of pharmacy technicians in the prescribed medicines, in questioning the patient, or in check the medicines before giving them to patients. So this is a list of tasks that pharmacy technicians perform in community pharmacies. And as you can see, in some countries, pharmacy technicians have more autonomy to do things that in other countries. So um, I believe the way you could develop your profession in Bulgaria, it's try to defend that you could have more roles, more tasks, and you could have more autonomy because you already have a very decent level of education for pharmacy technicians. So this is just a short presentation. If you want to know more about European Association of Pharmacy Technicians, or if you want to compare more your country with other countries, in our website we have different surveys that we performed during the years, and you could compare that. I just would like to add that for us, for European Association of Pharmacy Technicians, it's very important to have the contact with the Bulgaria Association, and I hope that you could discuss the membership of EAPT, and if you are available to be members of EAPT, you are more than welcome, because at European level, more we are, more power we have to take the decisions. So I really hope to count with the Bulgaria Association very soon in the scope of European Association of Pharmacy Technicians. So as I said, we have different surveys in our webpage. We could check the activities in community pharmacy, in hospital pharmacy as well, the activities of vaccination. In some countries, pharmacy technicians started to vaccinate, and this is something that we are supporting some countries to have in their scope of practice as well. And we also have a survey about the education and training programs of pharmacy technicians at European level that we will update this year. And those are the persons across the years in the European Association. The last photo is from Zagreb last year, and that's the moment where I take the president position. I really want to count with Bulgaria Association and Bulgaria colleagues at the European movement. So thank you very much. It's very important for us to cooperate with you and working together. I'm more than available to support your activities. And I believe with that, we could have the trust of patients, and we are in the right direction to have stronger profession. Thank you very much.